It's going to be a very hot week in the city. Daytime highs will rise above 30 degrees. Right now it's at 29, but it's going to feel closer to 40. That's with the humidex. It'll stay warm overnight with lows in the high 20s. The hot and hazy weather, it could cause a few thunderstorms this afternoon with isolated storms possible overnight. Right now, CP24's Andrew Brennan joins us live with more on this heat wave. Andrew.
Well, Bakari, it's not just thunderstorms that hot and hazy weather can impart. And when you think about how hot it's going to get, let's maybe go to the basics to remember of how to keep cool and also check in on the vulnerable people in our lives. And let's bring in Dr. Dina Kulik to help talk about how this really has to look potentially with children. Now, doctor, as a pediatrician, I guess the first thing that we do need to ask you, is there any difference really in how children versus adults respond to the heat and things that parents should be looking out for? You know, sweating, potentially lack of sweating?
It's an excellent question. Kids have a lot of surface area for their size, and so they lose a lot of heat much more easily than adults do. And so they may actually lose a lot of fluids, a lot of electrolytes when they're being active or even just hanging out in sometimes a warm classroom setting. And they may not sweat as much as older people as well. And sweating helps us regulate our body temperature. So you do want to touch base with your kids in the school setting, at home, at the park, etc., to make sure that they are staying well hydrated, drinking lots of fluids, staying out of the sun when possible, and of course sun protection like rash guards and hats and sunscreen as well.
I guess particularly checking in with them when they're at a school. Most schools in Toronto don't have air conditioning inside the actual classroom, so that would be a problem there. But I was reading from some children's hospitals that we were talking about with heat stroke. Over half of children don't actually sweat at that point when they're being admitted. Is that something that makes it harder for parents to be able to not only regulate potentially the body temperature of their kids, but also just be able to notice?
Yeah, so many kids won't sweat as much as older people, and sweating is a way to help regulate that body temperature. So I wouldn't be looking at specifically what your child looks like in terms of sweat, but rather, are they not as interactive with you as before? Are they losing consciousness? Are they confused? Do they have headache? Are they suffering from dizziness? And importantly, are they not saying that they're thirsty anymore? Because that's a later stage in terms of heat stroke. We want to make sure that your kids are drinking lots, even if they're not saying they're thirsty, even if they're not asking for water or for juice, popsicles, freezies. These are all things that can keep us with a cooler body temperature. So force it on your kids, even if they're not asking for it.
Dr. Kulik, just as we wrap up, we don't have really good data when it comes from public health or even the coroner's office about how prevalent heat-related illness and death is. As a pediatrician, how often do we see more children coming in potentially to the ERs and needing treatment during a heat wave or a heat dome like that we're having right now versus generally in the summer? Do you have anything that you can impart to us?
We certainly do see a lot more heat-related illnesses during the summer, a lot more kids feeling unwell, and of course, sometimes presenting to the emergency room with heat-related illnesses. But the way to prevent that is to anticipate it, anticipate that your child is going to drink less than they actually should. Just as many adults don't drink as much as they should either. So keep offering it little by little. Make sure that they're taking time in the shade, outside of the heat, outside of the sun, and be very mindful to touch base with them often. Kids and adults too can get, lost in the excitement of having fun in the sun. And so we want to be on them, asking frequently, and even offering the fluids, even if they're not asking for it.
Well, we'll be mindful to be giving those tips to people throughout the day. And we thank you for your time this afternoon. That's Dr. Dina Kulik joining us. As always, we appreciate your time.